Plague doctors, myth or reality? The image of the plague doctor, clad in a long dark robe, wearing gloves, and donning a bird-like mask with a long beak, has become an iconic symbol associated with the bubonic plague that ravaged Europe in the Middle Ages. These figures, both sinister and fascinating, have permeated popular culture and are often subjects of horror stories and historical intrigue. But who were these plague doctors? Were they real historical figures, or has their image been embellished by myths over the centuries? This article aims to delve into the reality and myths surrounding plague doctors. The historical context. Plague doctors were indeed real historical figures, primarily employed during the various outbreaks of the bubonic plague in Europe, with the most notorious being the Black Death in the 14th century and subsequent resurgences in the 17th century. The bubonic plague, caused by the bacterium Yersinia pestis, spread rapidly and killed millions. Cities and towns, desperate to manage the overwhelming numbers of the sick and dying, resorted to hiring plague doctors. These doctors were often not highly trained physicians. Instead, they were more commonly local practitioners, sometimes even barbers or individuals with rudimentary medical knowledge. Municipalities would hire them to treat plague victims, record the number of infected, and manage public health efforts. The plague doctor costume. The distinctive costume that plague doctors are known for was not common until the 17th century. Charles Delorme, a French physician, is credited with designing the plague doctor attire in 1619. The outfit was meant to protect the wearer from the miasma or bad air, which was believed at the time to be the primary cause of the plague. The costume included 1. A broad-brimmed hat. Made of leather, it was thought to protect the doctor from infection from above. 2. A mask with glass eye openings and a long beak. The beak was stuffed with aromatic herbs, spices, and dried flowers intended to filter out the bad air and protect the wearer from the miasma. 3. A long overcoat. Made from heavy fabric or leather, the coat was designed to cover the wearer from head to toe. 4. Gloves. To protect the hands from direct contact with the infected. 5. A wooden cane. Used to examine patients without direct contact and to maintain distance. The reality of their work. While the costume is the most striking feature associated with plague doctors, their actual work was a blend of rudimentary medical practices and record-keeping. Their duties included examining patients, diagnosing plague cases by examining buboes, swollen lymph nodes, and other symptoms, administering treatments. These were often ineffective and included bloodletting, administering herbal concoctions, and lancing buboes, keeping records, documenting the number of infected and dead, which was crucial for tracking the spread of the disease, public health measures, advising on quarantine measures, burial practices, and other methods to contain the outbreak. Myth versus reality. Over time, the image of the plague doctor has been shrouded in myths and misconceptions. Here are some common myths and the realities behind them. 1. Myth. Plague doctors were elite physicians. Reality. Most plague doctors were not the highly trained physicians of their time. Due to the high risk of treating plague victims, experienced doctors often avoided the role, leaving less qualified practitioners to fill the position. 2. Myth. The beak mask was universally used during the Black Death. Reality. The beak mask became popular in the 17th century, well after the Black Death of the 14th century. During the earlier plague outbreaks, no standardized protective gear was used. 3. Myth. Plague doctors had a deep understanding of the disease. Reality. Medical knowledge during the plague years was limited. Plague doctors operated under the miasma theory and had little understanding of the bacterial nature of the disease or how it spread. 4. Myth. Plague doctors could effectively cure the plague. Reality. The treatments offered by plague doctors were largely ineffective and based on the medical theories of the time, which did not understand the true cause of the plague. Their role was more about managing the epidemic than curing it. Legacy and cultural impact. The image of the plague doctor has persisted into modern times, becoming a symbol of the mysterious and macabre. This image has been used in various forms of media, from literature and films to video games and Halloween costumes. The eerie appearance of the beak mask and dark robes taps into deep-seated fears of disease and death, making it a potent symbol of pandemic. Despite the myths, the reality of plague doctors reflects the desperate and often futile struggle against one of history's most devastating pandemics. They represent an early attempt at organized public health responses, albeit with the limited knowledge and resources of their time. Conclusion. Plague doctors were indeed real figures who played a crucial role during some of history's deadliest epidemics. While their image has been romanticized and mythologized, understanding the reality of their work and the context in which they operated provides valuable insights into the history of medicine and public health. The Plague Doctor's story is a poignant reminder of humanity's ongoing battle with disease and the continuous evolution of medical science.